Have you ever really stopped to think about walking? I mean, it's something we do every single day, completely on autopilot. But what if I told you that hidden in every single step is a story? A really complex story about your health, your history, and maybe even what's going on deep inside your body and your brain. Well, today, we're going to learn how to read it. So let's just ask it straight up. What can the way you walk really reveal about your health? Is it just about getting from point A to point B? Or is it something more, like a window into how your body's doing? You guessed it, it's a lot more than you probably think. So for the next few minutes, let's put on our detective hats. We're going to learn how to spot the clues and decode the stories our steps are telling, using the very same techniques that clinicians use every single day. But before we can spot anything unusual, we have to know what we're looking for, right? We've got to establish a baseline. What does a normal, healthy walk even look like? Okay, the most basic building block here is something called the gait cycle. Now, that sounds technical, but it's super simple. It's just the full sequence of motion from the moment, say, your right heel hits the ground, all the way until that same right heel hits the ground again. That's it. That's one complete step. So, when a clinician watches someone walk, they've got this kind of mental checklist going. They're looking at your posture. Are you upright or stooped? They're checking the rhythm of your movement. How are your arms swinging? Is it even on both sides? They're watching how smoothly your legs move, the distance between your feet, and whether you can walk a straight line or turn without any trouble. All these things together paint a picture of what's considered a normal gait. All right, so we've got our baseline. Now for the really interesting part. What happens when that normal picture gets, well, disrupted? Because those disruptions are often the very first clues that something deeper might be going on. Now, if you boil it all down, problems with walking pretty much come from two main places. On one side, you have neurogenic disorders. That's anything to do with the brain, the spinal cord, or the nerves. And on the other side, you've got skeletal issues, which are usually caused by pain. You know that limp you get when you sprain your ankle or have a sore knee? Well, that has a clinical name, an antalgic gait. And this is where our detective work really begins. We're going to go on a quick tour of some of the most distinct abnormal gaits. Think of these as our case files. We're going to learn to read the specific signs for each one. First up in our case files is the circumduction gait. This one is really visually obvious, and it's often a sign of something called hemiplegia. That's weakness down one entire side of the body. The source material describes this with a fantastic phrase, an outward throwing or swing of the lower limbs. So just picture this. The leg is held really stiff and straight. And because the person can't bend their knee or ankle properly, they have to swing the entire leg out to the side in a big arc just to get it forward. That big arcing motion, that's circumduction. So the huge giveaway, the key visual clue, is that stiff leg swinging out in a big semicircle. You'll also usually see the arm on that same side held tight to the body, flexed at the elbow and wrist. This whole pattern points straight to a problem with the upper motor neurons. Think of them as the superhighways that send signals from your brain down your spinal cord. Okay, next up is a gait that you might actually hear before you see it. This is the foot drop gait. Listen for the auditory clue here. Normally, your heel hits the ground first, nice and controlled. But with foot drop, the muscles that lift the front of your foot are weak. So instead of a smooth landing, the foot just kind of falls. And it makes this very distinct slapping noise when it hits the ground. And to keep from catching their toe and tripping, people with this will lift their knee way higher than normal, almost like they're marching or stepping over something that isn't there. That high stepping motion, followed by the foot slap, is a classic sign of weakness in the ankle muscles, and it's often caused by an issue with a specific nerve, like the common peroneal nerve. Our third case file is one you've probably heard of. It's the gait we see with Parkinsonism, and it's all about this shuffling quality. This slide really captures the key features perfectly. You've got that stooped over posture, a really narrow stance, and then this quality the source calls festinant, which basically means hurried. The steps get smaller and faster, almost like their feet are desperately trying to catch up with their body. So when you put it all together, you see the stooped posture, those little flat-footed shuffles, almost no arm swing at all, and often this really tough time just getting started, a phenomenon they call freezing. This whole cluster of signs is classic Parkinsonism. And for our final case file, we're doing a complete 180.
If the Parkinsonian gait was small and shuffling, the ataxic gait is all about being big and unstable. I mean, this quote just paints such a clear picture. The person is unstable and tremulous, and they're reeling, almost like they're walking on the deck of a ship in a storm. And what do you do in that situation? You instinctively widen your stance to stay upright. They walk on a broad base to try and find some stability. So the big clues here are that wide stance, the uncoordinated, lurching movements, and a real difficulty walking in a straight line. This kind of gait points to a problem in the body's balance and coordination headquarters, which is primarily the cerebellum. That's the part of the brain that fine-tunes all of our movements. So, we've looked at all these individual signs, but how does a clinician take all these little puzzle pieces and actually start to form a hypothesis about what's going on? Well, this table shows exactly how that thinking works. It's not about spotting one sign, it's about seeing patterns. So an observer sees that dropped foot, that high-stepping, slapping gait we talked about. Their brain immediately jumps to, okay, could be a nerve issue in the lower leg. But they also have to consider, or is the problem starting higher up at the nerve root in the spine? Or they see someone taking those tiny shuffling steps. Parkinson's is definitely on the list, but a good clinician is also thinking about other possibilities, like normal pressure hydrocephalus. Every observation is a clue that helps narrow down the suspects in this big medical mystery.
So let's just zoom out for a second. This thing that feels so simple, so automatic, is actually an incredible symphony of nerves, muscles, and bones, all working together in perfect time.
And here's the bottom line. Every single step we take is a performance. And yeah, we all hope for a flawless show, but sometimes it's the missteps, the stumbles, the shuffles, the limps that tell the most important stories about our health. The way we walk is its own kind of language, and learning how to read it can make all the difference. So next time you're out for a walk, just think, what story are your steps telling today?